Hello, everyone. Welcome to the session on direct contracting strategies that increase value and reduce costs, part of our self-insurance strategies track at the World Healthcare Congress. I'd now like to introduce the moderator for this discussion, Steven Nelson, President for Contigo Health. Steve, it's a pleasure to have you with us today. I'd now like to turn it over to you to get things started. Thank you.
Thank you for the introduction. It's a pleasure to be here. I have a fantastic panelist that I'll come to in a second. But before we get started, really our session today is on direct contracting strategies that increase value and reduce costs. And I think I'd share some broad trends as a group. We discussed some of these trends in general before, and I think this is very relevant to kind of set the stage for where we are today around kind of employer challenges in the marketplace. As many of you know, obviously you're part of this track, so hopefully you're all aware, unless you're getting more informed about the self-insured space as we go. You know, 1 out of every 2 employer purchase healthcare really for Americans today. And so the employer is active in this space, as Ray, one of our panelists, will speak more about today. $700 billion of employer spend annually on healthcare, as recent data has shown. That's pretty substantial, obviously increasing. You know, out of that, 17%, nearly 1 out of every 5 large employers, 17% say that they'll directly contract primary care or an associated primary care model in select markets in the upcoming year of January 21-22 benefits, so more like January 22, if you will. When everybody looked back at the year of 2020 and they'd say, boy, you know, employers, 90% reported that they were at their trend or slightly below it. However, a lot of the employers have said they've already seen a substantial increase, 4.2% last year's budget on plan changes, et cetera, as they think about plan impact and cost to their associates, which is really high. And I think the pandemic has brought forth a lot of different stressful behaviors for all of us. Global pandemic, the needs are changing in healthcare like never before. And I think that they're changing for the associates on how they get delivered and, you know, what is the employer going to buy? Someone like Ray will be able to give us a little bit of that perspective, and Megan and Doug as well here in a second when I introduce them. But working from home, what challenges did that bring to bear? As we are all consuming our lives differently and productivity has increased, that's brought with it other challenges that we all have from working from home. So I'd say the challenges and opportunities around direct to employer care is out there. I think they're all trying to get a little bit closer to it. But we got a great panel today of experts in the industry. I'll introduce them by name and then I'll come back to them. And then we'll kind of get things kicked off with a little bit of a layup question and where they are. And I'll go in reverse order. So let's start with Megan Naretz. Megan is the founder and chief executive officer of Adept Benefits. Thanks, Megan, for joining us today. Doug Ginsner is the chief executive officer of Las Vegas Heals. And then Ray Bowman is the senior vice president of talent and team development for MarineMax. And I think just our layup question, I'll go in reverse order to kind of get things cooking. I'll go, Ray, with you first. You know, what problem, what were we trying to solve for when you think about high quality care and driving down cost and thinking about your employees and doing things differently there, Ray? In our precursor, you shared a lot about your journey and how your journey has led you to think about things differently. Share some of that with the people that are joining us today on direct contracting side. And then Doug, I'll come to you, and then Megan, you last around a similar question. Ray?
Well, thank you, Steve, and welcome to everyone on the presentation, and thank you for joining us today. I was thinking about how to help everyone out there listening to this webinar, this presentation as best I could. And addressing Steve's question, I think a revelation for me personally in terms of healthcare at MarineMax was the realization that we don't have to just follow along with whatever our large insurance carrier is presenting to us. I know that sounds odd, but the understanding that you can actually create a plan, a healthcare plan for your company or your organization, if you're willing to actually do something different. You have to be brave. You have to be willing to put in some time and some energy. But I will share with you what we've learned here at MarineMax is that if you're willing to do that on the front end, put in the time, put in the energy, if you have a entrepreneurial mindset, you can actually create a plan that is very positive for your employees. It's positive for plan spend. And in the long run, it's not only less expensive, but it's actually easier for your administrators and your HR folks. I think the key word is action, that you actually are going to have to do something. Now, you can choose not to. You can stick with the status quo. But I will tell you, and I think you already know, that if you stay with the status quo, your premiums are going to go up. It's going to be the same old drill every year with your insurance carriers. You may do that. Your CFO might not like it in the end, but frankly, you have a choice to make. It's a lot of work to improve your health plan. And so I'm just kind of addressing that to kick this off, that listen closely today and try to adopt the mindset that hospitals will actually negotiate prices. Specialists will negotiate prices. Facilities will negotiate prices. Who thought? You don't have to pay what they're telling you to pay. So anyway, there you go, Steve.
Great opening. Great opening. Thank you, Ray. I love that, actually. You gotta act for sure. Doug, you're a very action-oriented person. I think you're in the direct contracting space. I mean, sharing a little bit about what you see and the market that you saw, I think even in the discussions was really helpful. Could you share a little bit about that with the group as well?
Sure. So I kind of bring a different perspective. I sit on the provider side. And just as Ray alluded to, the providers want to do a good job of treating patients. So it's all about how do you deliver a better health outcome for a lower price. In the world that I spend my time, I'm in the bundled surgery business. And I could tell you that when you're able to put together those costs and deliver a 30 to 50% discount to a health plan, they get excited about that. But probably the part that's more exciting is the benefits that the patient, the member of that plan gets. And that is many times it comes with a zero copay or deductible. And at the end of the day, they're getting a better health outcome because those that are in the bundled surgery space, they're high performance folks. They're those that do a high volume of a particular procedure, which is what allows them to get to the high outcome measures to deliver those outcomes. So I think the three parties that are in this space, the patient, the provider, and the plan, all benefit from direct contracting. I look forward to the conversation here.
Great. Thanks, Doug. Megan, let's go back. You got the lead in, but I guess, a lot going on out there. I think large system and the areas of contracting in general, there's also some interesting approaches you bring, and maybe you could share a little bit about that perspective of aggregation, other opportunities you see.
Yeah, thank you, Steve, and thank you everyone for joining me. CEO and founder of the Debt Benefits and Employee Benefits Advisory Firm. So working with clients similar to RE/MAX and helping employers essentially provide better benefits at reduced cost. Started in the direct contracting space about 4 years ago and rolled out a plan, and within about 3 months set up 90 direct contracts, more so out of necessity to essentially remove noise and lower the member disruption that was occurring, et cetera. So I went through, to Ray's point, action is key, entrepreneurial spirit is key. To start transforming healthcare takes a lot of energy and a lot of time. And the outcome of that energy and time is incredibly worthwhile for the employees who are, to Doug's point, receiving reduced deductibles, reduced copays, many times waived deductibles and copays. And from the employer perspective, 30 to 50% savings with significantly greater control over their healthcare spend. So when we originally started doing direct contracting, we were doing independent providers as well as group practices, and recently have contracted with a couple of health systems in this area, large orthopedic groups, and really starting to build more of a community-based platform, because at the end of the day, healthcare is local. and people know their local physicians and they are comfortable with those local physicians. And so approaching essentially a healthcare plan change from a quality and a cost perspective, educating, using change management to help employees go from, A to Z is key. So we've had super positive experiences and continue to learn. It's an ever changing world. And I can't say that if I was in any other industry, it's moving as quickly as healthcare is right now.
Megan, maybe we stay with you here on the turn. It's almost like, when you're at the end, you get a turn question right back at you. Why don't we stay here for a second? Give us a little bit more about the how. And then I think as a group, we had an active conversation as well about what's it look like in the future. And I think that's probably a good turn back from you because of the advisor role. I love the Remax plug. By the way, it helps everybody visualize exactly what you're doing. Think about that. I think those are the 2 points, and we'll probably conclude back to Ray. And Ray had some tangible examples that he even shared back on the data side of things that he's done directly in the plan. That's a great example. But maybe a how example, and then what do you think it looks like in that 4 to 5 year lens? I think we're all struggling with that in the industry. It'd be great to hear your perspective on that from an advisor role.
Yep. So from a how perspective, I guess one of the key things is picking up the phone and having a conversation. So direct contracting is not as complex as it may appear. Providers want to provide good quality care, and they have a vested interest in direct contracting for purposes of getting their money quicker, not having to chase their money. Close to a third of every dollar that goes into healthcare systems are chasing for anywhere between 3 months and 2 years after they've given care to a member. So there's some huge wins from a provider perspective. And so really outlining what that looks like and ensuring that you can meet their objectives as well. Providers have been run by insurance carriers for so long that it's a refreshing conversation to essentially ask them what needs they have. And, primary care providers is a really good example. Primary care providers got hit harder during COVID than probably any other provider. And there's very few independent primary care groups left. And during this time, they took a huge hit. And so there's a significant opportunity to bring independent primary care providers really into the mix of providing local community-based healthcare. And so over the course of the last year, we've worked with the second largest independent primary care provider group in Washington. And because of those relationships and the referrals that are going back out to the community, it gave us the opportunity to have conversations with larger health systems and larger groups. And so that's been super successful in having those direct contracting conversations. In terms of the next 4 or 5 years, I think that local community-based care is going to be the key. So how you do that really depends on the community that you reside in. Some in rural areas, they're obviously going to have to travel for care. And what does that look like? In a metropolitan area, they have choices. So, which system potentially are you going to align with? And from a quality perspective, what does it look like? Hospitals don't specialize in every single service. And I think we've all come to realize that really quickly. Some hospitals are great in vascular surgery and other hospitals are great in orthopedics. And so, having one direct contract with the health system isn't the end all be all. Members still need choice in who they see from a provider perspective. And so, setting up direct contracts that are based on quality and cost and providing members with access to quality care that's relatively close to their home is vitally important. So that's kind of where I think it's heading. But, I'd be really curious to hear from Ray and Doug what their thoughts are.
Yeah, that's a great perspective. Let's go, Ray. Why don't we go Ray last? So Doug, we'll come back to you right in the middle. You get to go middle twice. Give us your perspective on some hows. I think that was really eye-opening to hear some things you've done and are doing in that space, and even our catch-up between our last call. Share a little bit about that how, and then I'd say the same thing. Honestly, Doug, take us to that. Where is it going? How to get there? Very good, great perspective, Megan. Doug, what's your thoughts?
So it really comes down to the plan document. Being able to steer care to the most appropriate place, the appropriate time is where it comes down to. So being able to redesign that plan document to allow for direct contracting is probably the most critical piece. Obviously, before that, it really comes down to getting with an independent TPA that's going to allow you to do that, because a lot of the ASO plans just frankly won't give you that flexibility. So that's the nuts and bolts to the how. I do want to expand upon something that Megan said, and that is the provider's willingness to direct contract and why they want to do that. And she nailed it with the fact that they spend about 27 to 37% of their collected revenues chasing that. And that is the billing, coding, collections process. And that's not what they want to do. So when they do a direct contract, they know exactly what they're going to be reimbursed. They know exactly when they're going to be reimbursed. And with that, they're willing to provide a warranty on their services. So everybody wins in that process. And I think more and more providers are willing to go there. Where do I see this in the next 4 to 5 years? I think you're going to start finding networks of direct contracts very similar to the old PPO networks. PPO networks once were the most favored nation and popular out there. I believe a lot of folks are going with these RVP style plans, which is very, very common out there. But at the end of the day, they're noisy. And so when you're able to reduce that noise by finding a predetermined preset price in advance, paying for that where it's very transparent and it's very clear and it's simple, I believe that's where we're ultimately going to land in the next 4 to 5 years.
Perfect. That's a great tee up from the advisor side. Ray, Doug, the provider, so advisor, provider, and now back to the employer. So Ray, I'll go back to you with that, which is the examples of how you obviously provided some to our team when we met in the earlier sessions, and then, maybe the how. And then I think Doug shared a little bit. Ray, maybe you as well. Give us that 3-5 years. Where does it pan out? How does it lead to? Where's it going?
Right, I'll do my best. So I was, when we had our pre-presentation meeting, I have never met Megan nor Doug prior to that. But I will tell you that I wrote down their names and I will follow up with them. And so that's an open invitation to the people who are viewing this presentation. Write down our names. Write down who we represent. Pick up the phone and contact us. World Healthcare has our emails, they have our phone numbers. Just think of that for a moment. Take a look at the notes that you've already taken. Do you see us as resources? Because we are. At MarineMax, we've established something called the Max Health Plan Solutions, whereby we're trying to help everybody and at no charge, zero, not a penny, zero, trying to help bring what we've learned to you. We're in the business of selling boats and yachts. We're not in the insurance business, but we've learned a lot and we want to share that. And so pick up the phone and call Doug, call Megan, and explore further than this 45 minutes or 1 hour, however long this is going to be for you, but explore that, take some action, reach out. Regarding the future, I think it's perfectly clear. I think the future is, from a business perspective, probably going to, in an insurance perspective, in my view, it's going to mimic the past. If you're an insurance company, are you going to change your profit margin substantially? Probably not. You might figure out new ways of creating that profit margin, but you're unlikely to back off of it substantially. So if we can assume that everything in the world is going to go up, from apparently now meat, from what I heard on the news yesterday, is going to go up, but certainly medical devices and everything else, those prices are going to go up. So what are we to do? Well, again, you're going to have to do something differently, like picking up the phone and reaching out to vendors who are willing to work with you. I want to hear what Doug has to say to me about spinal surgery, managing spinal surgery costs. But getting back to the how, and this is very important, I want to give you a simple example that we're doing at MarineMax today. We have actually several. I could spend hours talking to you about it, but I'll just give you this one. So we kind of work backwards. We start with, where are we spending money? And right now, we've addressed many of those, but right now we're looking at cancer. Been looking at cancer probably for 2 years. We don't have, thank you, Lord in heaven, we don't have a lot of cancer in our company, thank goodness, right? But the ones we have can be pretty expensive. And I'm sure that's true probably across the country. So what we're doing here at MarineMax is we're looking at ways to manage cancer on the front end. Can we detect folks, employees who are at high risk for cancer? Yeah, we can't know who those people are specifically, but we can educate our population. We can inform our broker and our plan administrator to look for the codes that represent oncology, right? So someone has to visit an oncologist, that's a red flag, and we step in. When I say we, our broker and our third-party administrator step in to start helping this individual work through their cancer. Once people hear the word cancer, they stop thinking. The brain kind of goes numb, doesn't it? It would for me. So at that point, we're sort of captured by the medical community. It doesn't have to be like that. We can actually learn a lot about our cancer. We can learn a lot about the treatment options. We don't always have to do what the doctor says, and I can give you 1,000 examples of that. So part of the how is being willing to identify where your spends are, where your, well, I'll call them hurt points are in your plan, and then doing something to address those. The COVID has made us become so much more aware of the prospect of using virtual care. I'll give you an example of this, and you all know this. Telemedicine is like the new thing. So it's been around for several years actually, but you know, everybody's talking about telemedicine. It took me 2 years of searching to find our telemedicine group because they're all emergency room trained doctors, right? It's not just a regular MD, DO, or whatever. These are emergency folks. So at MarineMax, if you use our telemedicine guide, you have to go to the emergency room. Our doctor calls the emergency room, triages your situation. So when you walk in, you go right to the back and get the care you need without sitting in a waiting room full of sick people. Well, that took a lot of work, but it's an awesome company. UCM, United Concierge Medicine, is who we use. There's a lot of examples of that. We do virtual physical therapy, but these aren't just typical physical therapists. You're probably learning about me now, right? It took me a good year to look at all of the virtual physical therapies out there. Our physical therapists are advanced trained. You do not need a prescription at MarineMax for physical therapy, right? And both Megan and Doug have I think, referenced, you know, the how part of incentives. You can go to any physical therapy you want to at MarineMax, you know, and we pay for it, well, a significant portion of it. However, if you go to our physical therapy, and our employees trust that we've done a really good job, which is true, of finding the best providers. If you go to VPT, it costs you nothing at MarineMax. That's an incentive. Doug was using the word steering. Well, I'm not crazy about that term, but that's what the industry calls it. Steering employees to high quality care, that's what we're doing, and also care where we've negotiated pricing. So again, you have to do something. You actually have to do something. No one's going to come to your company or your organization and knock on your door and bring you all of this. You have to pick up the phone, reach out to Megan, to Doug or myself, or others, and start this ball rolling. Sorry for that lengthy response.
No, that's a great one. I'll throw myself into the mix, Doug, as well, just for calls.
Yes, Stephen.
But not as open as you. That'd be awkward. I'll do it though. That was great, very helpful. And I think the dynamics of the market, you also leaned in there at the end, which I think is great, Ray, to talk about what's going on from COVID and how it impacted you, but you sought out different sources of value. I think from an advisor perspective, Megan, maybe I'd go to you and say, are there other things that have happened from the pandemic where you'd see sources of value? We gave a little nugget about the future. We talked about how, gave a nugget about the future. Now we're thinking about what we're all dealing with in the moment. Actually, as we sit here, many people are here listening in the moment, thinking about Benefit Design 21, did what? What am I doing for 22? And boy, what's my nugget for 23? Most likely someone's in that ecosystem listening in today. If that was a thought, let's go Megan, Doug, and back to you, Ray. But Megan, what's your thought on something that you're pivoting with, something that you adjusted with? We've had to do a lot of customized TPA work at Contigo. Didn't expect that. You mentioned specialized TPA services, Ray. That's really one thing that we're doing a lot more of. That didn't expect that coming out of it, but we're doing it because people have unique needs now. We're trying to meet those unique needs. Megan, I'm sure you have some in that advisor role. Can you share a little bit about what you've seen that's new or that you've pivoted on from your business perspective?
Yeah, absolutely. And just to follow back up on what Ray just mentioned in terms of vetting vendors, he stressed it, but I couldn't stress it enough that, reach out to Ray and figure out which vendors he's working with, because I'll tell you that is the number one challenge in putting together a program that works for an employer and the employees is finding the vendors that are going to do the hard work that it takes to set one of these plans up successfully. Great to hear that Ray did the vetting with regard to a virtual PT group, and to think, oh, I'm going to go out and look at virtual PT groups. Like, I'd love to hear, at some point back to you, Ray, and say, honestly, like how much due diligence and how much time and energy it took to go through that vetting process to be able to make a good decision for your employees. I mean, it's a significant lift. And, the work that Doug's doing, finding vendors that are going to meet employers where they're at with the vendors that they're at, because to Doug's point, the SPD and the TPA and everything working together is so vitally important in setting up one of these programs. And so, I just wanted to quick touch on that, given that it was kind of a layup from Ray. One of the areas very dovetails on vendors potentially not doing what they say they're going to do is we do a decent amount of member advocacy. So while we rely on vendors to provide some of the member advocacy, the reality is that no one is going to take care of our clients the way that we're going to take care of our clients. And no one's going to care when someone's at the hospital and they're trying to get their husband into a long-term care facility and the pre-auth hasn't gone through. That TPA is going to answer the phone, but are they going to jump through hoops in a matter of, hours that's needed to get that employee to the facility they need to be at, or the member? So we do a lot with regard to member advocacy. And if you're an advisor and you're thinking about moving into this space and doing direct contracting and working to set up these types of programs, I would just tell you, you have to be brave. You have to have the entrepreneurial spirit, as Ray said, and you better have a lot of grit, because the reality is it's going to be an uphill battle managing these programs and ensuring that the client and the member experience is phenomenal. So again, we've spent a decent amount of time around member advocacy. What does that look like? How do we connect our vendors on the back end so that we don't have to provide that, third party? For example, when a medication isn't covered by the PBM and we're routing it to a specialty pharmacy, getting EDI feed set up on the back end so that process is seamless from the employee's perspective. All of those little nuances that you would never even think of unless you had implemented the plan and learned the hard way become a reality. So, talking with folks that are doing this type of work and, learning through other people's failures and hardships, I couldn't stress enough.
That's fantastic. Doug, how about yourself? Anything where you'd say, hey, don't forget about this, don't forget about that pivot. Yeah, that's, we did the how, we did the long term. What about now? Is there somewhere where you see the provider side also pivoting? Obviously, in the space you're in, there's a big pivot there. But just in general, Doug, and maybe even some specifics on that, what have you seen as a need?
So, yeah, thank you. I think the biggest thing that the pandemic demonstrated to us and validated was the value that the ambulatory surgery center world brings to the equation. So we're all looking to save costs. And so when you're able to move a procedure from a hospital to an ASC, the amount of savings that comes just directly through that reduction in the facility fee is where we find the greater savings. Now, where do we find the greater value in terms of patient outcomes? It's the same spot. So the ASCs typically are a safer environment in terms of infections and what have you. So you're able to get a better health outcome for that lower price in the ASC. And then the other part is the teams that come with that ambulatory surgery center. So a lot of your surgeons are credentialed at hospitals and may or may not work for the hospital. So when they walk into that OR, that team that they're walking into is a mystery. And what I mean by that, they may or may not know the anesthesiologist. They may or may not know the first assist or even the scrub tech. And that team environment is what dictates how well that surgery is performed. And using the total joint replacement world, it may take a surgery time from 45 minutes down to 26 minutes, just because of the efficiency of that team in the ASC environment where that surgeon is, and I hate to say in control, but they walk in, it's their team, it's their tray, it's their OR. And so I really look at where the role is of the ASCs, because today we probably do, let's look at just lap choles, so gallbladder removals. About 90% of those are being done in a hospital when 95% should be done in an ambulatory surgery center. And that reduces that cost probably 70% just by moving it to a safer place of care.
Yeah. Doug, as a follow-up to that, when you see how maybe the additional growth, was there additional pandemic impact in general to some of those things and surgeries and care? I think that, in our side conversation we had regarding utilization in general, you saw a little bit of a turn, if you will, within those centers as well. Can you expand upon that a little bit?
Yeah, so frankly, some of the ASCs that I work with, we didn't shut down during the pandemic. They shut down elective surgeries around the country. As a privately owned ASC, we had the choice of not shutting down. We notified our governor and the hospital association and our transfer hospitals that, hey, look, if you need our equipment, we will hand deliver it. But in the meantime, we're going to continue performing surgeries, and we did. And we saw an uptick because a lot of folks that needed total joint replacement were now laid off for 30 days, 60 days, 90 days, and they had that time to do that. But the other thing that became evident was there is, or was, and maybe still is, a fear of going into a hospital, because that's where the big Rona, the COVID-19 was. So there was a fear of going into the hospital. So a lot of folks just felt safer in an ambulatory surgery center environment.
Yeah. And I guess going over to you, Ray, when you look at the employer side of the equation, you see really, from your perspective, Ray, and you've approached benefits differently. That's for sure. I've learned a lot. It's been great engaging you in this process. Share a little bit more, Ray, what you're seeing. Because I think now that employees are coming back, utilization, noted that at the very beginning, is coming back. I think it's relevant to all of our spaces here today, between the advisor side, the ASC side for sure, on destination care in that regard, and definitely you being the employer voice in that space of utilization, Ray. What are you seeing as people are now consuming benefits? And we are all hopeful of this time of getting back to things in somewhat of a quote unquote normal fashion from a global pandemic. But what are you seeing in some of that? Because I think that could be a tipping point, Ray, as people are thinking about differentiating their benefit design. What they have to do differently, as Doug just articulated, maybe there's a benefit impact as that as well, that eventually reaches the associates on the floor working on the environment in a production area or sales or et cetera. What's your thought about that, Ray, when you look at your employee book of business that you're overseeing for benefits?
I've got to tell you that I'm very doubtful that we're ever going to return to what we would have referred to as normal, probably across our society, frankly. And I'm thinking of what happened in Japan some time ago. But anyway, yeah, I think our employees are going to come back to work for sure. Some of them will come back full time like they did before. Some will come back part time. Some will work remotely entirely. But what's happened is a few things have happened as a result of the pandemic. One of those is that we've gotten used to communicating like this through virtual conferencing, and we've gotten used to getting physical therapy now without getting in our car, driving there, waiting in the waiting room, hanging out with 4 or 5 other people while our physical therapist runs around the room. We've gotten used to getting virtual physical therapy right now, right in front, right on Saturday evening at 7 o'clock. Imagine, right? Yeah. So the idea, my wife has a sore throat. We don't have to call our doctor, and she's very, very good. Don't misunderstand me. And get in the car and make an appointment, because you never get a sore throat during the day. You always get it in the evening or 2 o'clock in the morning. So now we just pick up the iPad and we talk to this emergency room physician, right? So why would we go back to something complicated, right? So I think that's a part of it. This has invited us to think differently and to take new opportunities and new perspectives on things. Doug was just referencing surgery centers rather than going to the hospital. A decade ago, maybe 15 years ago, would you have thought to have surgery anywhere but the hospital? But what's so special about a hospital other than increased infection rates, right? So in fact, Doug can contest, the outpatient surgery center infection rates are less than what happens in many hospitals. The other thing, just as an aside to this, or I guess it's directly related, but you've heard of the COVID-10, right? Instead of COVID-19, it's those 10 pounds that everybody's gained, right? Yeah. So one of the things we've done at MarineMax is we've upped the game for our diabetics. So if you're a diabetic in our workforce and you stay on your program, we pay for all of your medications, which can be your insulin, etc., your doctor visits. 100% is paid for. Steering and incentivizing, the team member to do really what's good for them, frankly. So I think virtual's here to stay in one form or another. I think Megan and Doug both mentioned cash is king. I want to give you a quick example of how powerful cash is. True example, we had one of our employees having some heart difficulty. And so he needed a procedure at a local hospital. We have some really great hospitals here locally, well, in the Clearwater, Tampa, St. Pete area. And so it was $112,000 for this procedure. Picked up the phone. Here's the action part. Picked up the phone, talked to one of the VPs at the hospital where he wanted to go, and simply said, that's just too much money. I know what this procedure is. I know how long it's going to take. I know what's needed. You deserve to make a profit. I get it. Nothing wrong with that. Profit's good. You're in business. Get it. I'll cut you a check and send it. We have a saying here at MarineMax called cash is king. I'll cut you a check for $56,000, which I know is going to make a profit because I've done my homework. You're going to have a handy profit, well over Medicare. And they said, love it. there wasn't even a difficult conversation. They said, you're going to send us cash. You're going to send us, yes, that's what we'll do. So what did we say? $50,000, one phone call. I know that's maybe counterintuitive to a lot of the people listening to this presentation, that Are you kidding? A hospital is gonna you can do, we call it individual contracting. Individual contracting. Everybody on this panel knows that term. Yeah, you can do it, but you have to do it. We're just so used to sitting back and just doing whatever the big insurance company says. And this is, talk about some warped thinking. Imagine this. We think the insurance company is going to pay that $112,000. Well, they're not. They're not going to pay that much because they've been smart and they've already contracted with the hospital as to what these things will cost. But more importantly, they don't pay for it, do they? We pay for it.
You do.
We pay for it. Everyone out there who's listening to this presentation, understand, insurance companies don't pay for healthcare. No, they don't. That's why they have these huge, humongous structures in every city in America. Biggest, tallest building in the city, every city, will be an insurance company. They don't pay for it. We do. We do. So, keep that in mind. Negotiate, action. Call Steve, Megan, Doug, or myself. Just follow.
So I'm gonna lean in on what Ray just said, action oriented. I think it's really helpful. I think just to kind of get feedback and so where are we at with kind of a final round here. And I'm going to go back in reverse order. And I wanted to start on something that actually we are very proud of at Contigo Health, which is the relationship. And we talked about it as a group, which is, and raised all over this, which is the relationship matters, right? The call, the communication, the reach out, I called it, the employer and the health system, they're talking, right? And I think a lot of that matters. So let's go back, because I think some interesting thoughts, Megan, and I'll close with you on that. We can kind of come back through this then, great discussion, kind of a final Q&A round, if you will, which is this. Megan, we talked about the relationship in the pre-meeting. We've had a lot of dialogue about the action. Ray's talked about the action, the need, pick up the phone, individual contracting. It's funny you use that term. Love that one. I think that it's a lot there. So how to kind of maybe give us a couple minutes, think about the relationship side and the differences you can make in that, because I think that's a good feel good on action, right, Ray? So maybe we go to Megan, you first. Talk about how the relationships matter, please, kind of in closing as we wrap up.
And Steve, I apologize. When you talk about relationships, you're talking about relationships with the client or the provider?
I'd say both from your perspective. So why don't you give it to us as your perspective on how it matters to bring the parties together effectively? Yeah,
absolutely. Well, on the provider side, they very, very infrequently have providers ever heard from an advisor when I call and talk with them about direct contracting. So from a relationship perspective, they're kind of confused. They don't understand why I'm calling. They are trying to better understand I represent what client and what am I trying to accomplish? So it's like 5-10 minutes of, explaining what it is we're doing. And then this light bulb goes off and they get super excited and they want to be part of the program. They want to be able to do what essentially clients are doing in that relationship. I think it's built pretty quickly because it's really all upside for providers. There's no downside. They're not getting lesser reimbursement. They're not having to track down their money. They're not having to, have their hands tied by an insurance carrier. So there's so much upside from a provider perspective. It instantly builds rapport. And then when they know they're connecting with a local employer in their community, that's exciting. Doctors got into practicing medicine because they wanted to help people. And so, it's as disturbing to them as it is to all of us that, healthcare is so broken. So, they're excited that there's, folks like us that are out in the world trying to do something different and provide a better career and quality of life for their providers and their employees as well. So I think that, there's instant rapport that's built on that side. And then with regard to clients, I would just let, from a relationship perspective, helping the client understand that this is going to be a little bumpy, right? These plans, it's not like showing up at the Blue Cross Blue Shield. plan where they run your membership through the Blue Cross card and they say, okay, no problem. Like, or you can get a specialty medication for 90 days at $5,000 a month. Like, these types of changes are not easy sometimes with regard to member disruption. So, and when you show an employer 30 to 50% savings, all of a sudden, like, they don't hear everything else that you say, right? Like, they're like, oh, 30 to 50% savings and better benefits. Like, they miss like what disruption really looks like. So we've gotten laser focused in trying to help articulate what that looks like so that the relationship, remains intact and that they understand what this journey looks like for both them and their employees. So you definitely become a lot closer with your clients because you talk to them a lot more. It's not a twice a year renewal meeting. So anyways, that's my perspective.
That's good. Great. Doug, yours relationship side as we close.
So relationships are the key to everything. No matter what you're doing in life, it comes down to relationships. And I encourage everybody to build the relationships when you don't need it. So when you do, it's just a matter of calling the person that you need to speak to. So in my world, I maintain relationships, obviously, with my providers. And then on the other side of the equation, it's primarily with benefit advisors. And there's not a day that goes by that I don't get a random call from a benefit advisor going, Doug, I've got a curveball for you. Can you find somebody to do a breast reduction on a 15-year-old female that's medically cleared in an ASC? And most times my answer is, I don't know, but give me 24 hours. And then I've got my network of providers that I call and I say, who's able to do this? And to solve that problem, it really comes down with the relationships that we have today, so we know where to call when that issue comes in tomorrow. So absolutely,
No doubt.
relationships are key to everything.
Yes. Ray, I'll close with you. You are a relationship guy. You've been awesome through this. So I'll close with you just to kind of give your closing thoughts, but also on the relationship side of the house.
I couldn't agree more with what Doug just said, frankly. We always wait till there's an emergency or we're in pain or, there's a significant issue going on. But, if we're smart, as both Doug and Megan have emphasized, actually, take a look at those relationships that you want to use in the future. Those are going to be your hospitals, your freestanding surgery centers. Reach out again. It's interesting how we keep coming back to the idea that to make things better, you actually have to do something. I'm in physical therapy, literally went to physical therapy myself because my virtual physical therapist was very, very straight and said, this is not an area that she can handle. I won't go into details. But I was thinking afterward on my way home, the only way this is really going to work is if I do it. Right? Physical therapist shows me what to do, gives me these sheets. This is what to do. Okay. Then I'm driving home and I'm thinking, I'm going to have to do this if it's going to help my back. I'm actually going to have to do this. I'm going to have to do this. And so in closing, I think that's something I'm sure all of us want every viewer to go, to go back to work with or back home to work with is, I accept the challenge. I'm going to actually do something for myself and my company. I'm going to do something.
Yeah.
You, Steve.
Well, that's great. I want to thank all of them, Megan, Doug, Ray. Awesome. Really enjoyed the time getting to know all of you. I think to Ray's point, obviously we are always available. Our information is out there, and that's why we're doing this. So if you want to reach out, I think all of us are more than willing to kind of help out as we go. And so I'll thank you again for joining us and really appreciate the time that we spent today.
Thanks, Steve.
Bye, everyone.
Bye.